Welcome back to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's example is a 10-year-old male neutered lab with right front lameness. You find shoulder pain and decide to radiograph the right shoulder. I'll show you both views. We've been working on orthopedic cases for the past several sessions, so you know to follow a systematic approach using your ABCDs to trace each bone on each view. In this patient, we have one more step to consider, but let's start with our orthopedic findings first. When I look at the lateral view in particular, I see a sharply margined area of new bone formation on the caudal aspect of the humeral head, and also some remodeling on the caudal aspect of the glenoid, and a little bit here at the neck of the scapula. These findings we've talked about before as periarticular new bone formation, which can be a combination of osteophyte and enthesiophyte surrounding a joint. This is a non-aggressive finding of degenerative joint disease, and in particular in the shoulder, is very frequent in dogs. When we're doing orthopedic cases and we use our ABCDs to accomplish that systematic approach, the one thing that we can miss out on is we need to make sure that we remember to look at the entire radiograph. When we're looking at the distal limb, often the entire radiograph will only include our orthopedic anatomy, and so our ABCDs get us everything we need to know. But in this case, not only do we have the right shoulder that we're interested in, we have a little bit of the left shoulder and even a little bit of the thorax. So what I want to bring your attention to is this area of lung that's included on the edge of the field of view. You can see that where the cranial thorax is included in the study, instead of having nice crisp lung fields, we have the impression almost of a nodular appearance within these included lungs. I'm going to go to the other view just to remind ourselves what it looks like and to also get the chance to see whether we happen to capture any thorax. You can see on this other view, there's maybe only a whiff of the cranial lung here, and we can't really say much to sort of corroborate what we saw on the other view. So in this case, where I would land is that we have shoulder arthritis of the right shoulder. In a 10-year-old lab, this is not unexpected, and in fact, it may not relate to the patient's current lameness. Correlation with the orthopedic examination would be necessary. But as an important finding, we have concern for increased opacity in the lungs, but this is incompletely characterized and warrants further assessment. I'm very concerned that this pattern could be nodular in nature, but 3-view thoracic radiographs would be warranted to help, first of all, confirm the lung pattern indeed as being nodular, to look at its distribution as to whether it's diffuse in the lung or isolated to a certain part of the lung, and look for concurrent pathology, which could include lymph node enlargement, cardiomegaly, pleural fluid, for example. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.